Most men think erectile dysfunction is only about testosterone, age, or pills. One of the biggest hidden factors is blood flow, and one surprising drink may help support that system naturally. For most men, erectile dysfunction is more than a single problem. It is a signal from the body that something deeper may be going on. The ability to get and keep an erection depends on healthy blood vessels and nerves, and these systems can be affected by a long list of everyday factors. High blood pressure, for example, stiffens arteries and reduces blood flow, making it harder for the penis to fill and stay firm. Diabetes damages small blood vessels and nerves, often leading to weaker erections years before other symptoms appear. Extra weight, especially around the belly, drives inflammation and lowers the body's ability to produce nitric oxide, a key molecule for relaxing blood vessels. Smoking delivers a double hit. It injures the lining of arteries and speeds up the buildup of plaque, both of which restrict blood flow. Poor sleep, particularly sleep apnea, raises stress hormones and lowers oxygen levels, putting more strain on vascular health. Drinking too much alcohol can blunt nerve signals and interfere with the release of nitric oxide. Even medications prescribed for blood pressure, depression, or an enlarged prostate can sometimes worsen erectile function. And there is stress. Chronic tension constricts arteries and disrupts the delicate balance needed for sexual performance. When these factors pile up, the result is not just a bedroom issue. Persistent erectile dysfunction can be an early warning sign of heart disease or metabolic problems. That is why doctors now urge men to see erectile dysfunction as a call to check on their overall health, not just a symptom to mask. The real solution starts with supporting the body's circulation and metabolic health, not chasing quick fixes. Beets stand out in the produce aisle for one reason. They are packed with natural nitrate. This is not the same as the additives found in processed meats. In beets, nitrate acts as raw material for a remarkable biochemical chain that supports blood flow. After eating or drinking beets, about 2/3 of that nitrate is pulled from the bloodstream into the saliva. Here is where things get interesting. Bacteria living on the tongue convert nitrate into nitrite. That process only happens if those bacteria are healthy and active. When you swallow, nitrite travels to the stomach and then into the bloodstream, where it can be further reduced to nitric oxide, especially in low oxygen spots, like working muscles or the erectile tissue during arousal. Nitric oxide is the body's natural vasodilator. It tells smooth muscle and blood vessel walls to relax, which widens the arteries and lets more blood flow through. In the penis, this relaxation is what allows the small arteries to open wide, filling the spongy chambers and trapping blood for a firm erection. Without enough nitric oxide, that process breaks down. Arteries stay tight, blood flow is limited, and the body cannot sustain rigidity. Beet juice offers a logical, science-backed path to support this system. By providing a rich source of dietary nitrate, it gives the body more of the building blocks needed to generate nitric oxide. The result is not a quick fix, but a support for the underlying physiology that healthy erections depend on. This chain, from beet to nitrate, to nitrite, to nitric oxide, reflects the same pathway targeted by prescription medications, but it starts with what is on your plate. Clinical studies put this nitrate pathway to the test. In a controlled trial, a single serving of concentrated beet juice, about 140 milliliters, lowered systolic blood pressure by 8 points within 2 hours for adults with hypertension. A review of 13 randomized studies found a consistent trend. Acute beet juice doses reduced systolic pressure by 5 points on average, while longer-term use led to a more modest drop. These numbers matter because even small improvements in blood pressure can translate to healthier arteries and better blood flow throughout the body, including to the penis. Trials also show that beet juice can improve flow-mediated dilation, a marker of how well blood vessels relax and respond, directly tied to the nitric oxide effect. Most people tolerate beet juice well, but there is an important exception. Anyone taking prescription nitrate medications, like nitroglycerin for chest pain, should never combine them with high nitrate foods or supplements. The risk of dangerously low blood pressure is real. For men with ongoing erectile difficulties, a conversation with a healthcare provider is essential, both for safety and to check for underlying heart or metabolic issues. A practical approach starts with habits that support healthy blood flow every day. Regular exercise, even a brisk walk or a short bike ride, signals the lining of blood vessels to release more nitric oxide, making arteries more flexible and responsive. Quality sleep, especially 7 to 8 hours a night, gives the body a chance to repair the endothelium, the thin layer inside blood vessels that controls relaxation and constriction. Cutting back on alcohol and quitting smoking both protect this critical lining, helping maintain the delicate balance needed for strong circulation. Stress management matters too, since chronic tension keeps arteries tight and blood pressure high. For men, considering beet juice, product choice, and routine matter more than chasing the highest dose. Beet powders and concentrated juices can vary wildly in nitrate content, sometimes by more than 50% between brands or batches. Look for products that list nitrate content or have third-party testing, and avoid those loaded with added sugar. Consistency is more important than mega dosing. A moderate serving each day, paired with movement and sleep, supports the body's own nitric oxide pathway. No single drink will solve everything, but these choices, stacked together, give the body its best shot at healthy blood flow and better performance where it counts. Erectile dysfunction isn't just about age or desire. It is often a sign of blood vessel health. If it persists, talk to a doctor. Sometimes it is your body's earliest warning. Take it seriously.